Hi everybody, my name's Josh Shafson, and I'm the Director of Infection Prevention and Control at Cincinnati Children's. We're here at one of CPS sites for giving out supplies, and we've been asked to help talk a little bit about infection control, which is preventing transmission of illness from one person to the next. So what we're going to talk about today is a few principles and a few practices. The first is hand hygiene. So you all know that this is alcohol hand gel, and you want to use this often. Okay, there are a lot that come with moisturizers, and so they won't crack your hands. In fact, most of them do, but this is really the single most effective way to prevent infections. We're social distancing, but every so often you can't be 6 feet or more away from each other, and that's where the masks come to help. It doesn't replace social distancing, but it is a helper. Now Reed's going to show us how to don gloves. So anytime you put on or don gloves or take them off, doff them, you need to do hand hygiene, just like he's doing. Wonderful job. Thank you, Reed. Gloves are not a substitute for hand hygiene. They breathe, and so they're not impermeable. They can't block everything. Another thing that people ask us is, can I just use alcohol hand gel on my gloves? And the answer is no, because things accumulate on gloves and we don't know if the alcohol hand gel damages the gloves themselves. Now these shifts, so you would not want to use it on your gloves. These shifts are about 45 minutes long, and so you can probably use the same pair of gloves for the entire shift. If they were to tear or somehow break, then you would take them off, throw them out, do hand hygiene, and don a new pair, put on a new pair. Every site is a little bit different, and there are going to be different ways that people make things work, but the principles are basically the same. So social distancing number 1, masking number 2, hand hygiene number 3. So for workers at this site, as you can see, this site is a drive-up site, and so our staff are wearing masks and they're wearing gloves. And so it's appropriate for us to group our supplies where the car is coming, and we're going to ask people not to get out of their cars. If people were walking up, we might want to keep our supplies further back and set out individual supplies 6 feet apart from each other. We might want to use our cones to help direct people to stay away from one another so that they're not crowding together. Now, one thing is, especially when you're outside and it's a lovely day today, but as the weather gets warmer, masks are not comfortable. Most people you may see around, they're going to be wearing their mask a little bit like this. They're going to be messing with their mask because it gets sweaty. All of that is very hard to deal with, but very important to pay attention to. So a mask is only effective if it's covering your nose and your mouth. Having it on your chin is not effective. And playing with your face and playing with your mask is going to lead to more potential contamination. There are 2 ways around this. One is try to train yourself to not be messing with your mask. One thing you can do is when your hands are idle, just put them together, clasp them, or put them in your pockets, or hold them behind your back. Another is that anytime you touch your face, make sure you do hand hygiene, or just make sure you're doing hand hygiene frequently, every 15 minutes, every 20 minutes, every 30 minutes, especially when you're working this way, so that you're protecting yourself when you absent-mindedly touch your face. So to sum up, we've talked about a bunch of things, but the main principles that we're going to use at these types of stations and really anywhere is number 1, social distancing. Try to stay 3 to 6 feet away from absolutely everybody all the time. Number 2, hand hygiene. That is really the best way. If you touch something that's contaminated and you use hand hygiene, then touching your face after that is not going to lead you to get sick. The third thing is if you're going to wear PPE, masks, or gloves, wear them correctly. And then the last is if you do develop any sort of symptoms, be them look like allergies or a cold or a cough or a stomach upset, please do not come out in public, stay home, call your physician, and go from there. I want to thank everybody for all the work that you're doing, and I hope you're staying safe. Thanks for everything of helping all of our students in Cincinnati to continue to learn. And we'll be working with CPS moving forward to make sure that everybody at these stations are safe.
On behalf of the Cincinnati Public Schools Collaborating Care Team, we would like to give our utmost gratitude to our 23 site champions. We would like to thank them for their time and dedication to the safety of our children. We'd like to also thank Cincinnati Children's for their tips and resources on how to maintain safety at all 23 sites. Thank you.